Good afternoon, ladies and gentlemen, dear chief guests and honorable ministers. My name is Lydia Mubiru. I lead the team at Alias Count Uganda. Alias Count Uganda focuses on one of the most critical windows of opportunity, early childhood development, and we believe this is the critical action that Uganda has for making the future of this country much better. Thank you so much for the partnership.
It is now my pleasure and honor to launch the National Situation Analysis of Early Childhood Development in Uganda, the service delivery and access.
And all those who have copies of the situation analysis, wave to show.
My name is Lydia Mubiru. I'm the team lead for Alias Count Uganda. Alias Count Uganda is a national independent NGO whose main focus is early childhood development. And when we talk about early childhood development, we are talking about children from conception to 8 years. That's the first age for every human being in life. And those are the most critical windows of opportunity to impact any human being in the world. We all know that that's the most important phase when the brain is developed. Actually, we say by 4 years, a human being's brain is already developed. That means everything that goes into a child's right from conception equals so much into what they will become later in future. So in partnership with the Ministry of Gender, Labour and Social Development, who is the coordinator of early childhood development in Uganda as government, we have worked together to do the first ever national ECD situation analysis. And the situation analysis is focusing on service delivery and access for young children to services that should enable them to grow and develop to their full potential. And so the ECD situation analysis being launched by the Minister of Gender, Labour and Social Development today on the Day of the African Child is very, very significant, because when we talk about the African child, everything about the heritage, what they become, who they are, how they are made starts with the first years in life. And this is the situation that Uganda has done. It's our first ever. We are looking at all the key services that young children 0 to 8, from conception to 8, should be able to access. And that's early learning, that's play and stimulation, that's nutrition, that is parenting and responsive caregiving, that also involves family strengthening, whereby parents are able to take care of their children. And we are looking at maternal and child health and child protection. And so the situation analysis went in to see how many children, which children are accessing, who is being left out. We know that when we look at this population, according to the CTAN which has been done, over 28% of Uganda's children are in the age group of conception to 8 years. And that means that the foundation of our country, whereby our country focuses on human capital development as a key component for our national development plan, is within those years. Whatever we do, whatever we invest will come out then. So this situation analysis is highlighting in each of those services who is accessing, which children are being left out, where are the challenges, where are the gaps, and how do we ensure that more children are accessing this. We know many children are stunted, for instance. We know some parents are not attending antenatal care, and yet antenatal care is very critical for brain development in the early years. But also this report goes a bit into what else should we look out for. Are we as a country financing early childhood development? Do we have budgets for the services that reach the most vulnerable children, who are the youngest children? We know that most of our children are in rural areas, but we know there is a very huge gap on access for children in the rural areas. So this report will help us to understand who is accessing, what are the challenges, what does uptake look like, and how does that impact on our children being developmentally on track. The report shows us how many of our children are falling in the cracks of not accessing services, and how many are able to develop because they are accessing services. And it is a call to all key stakeholders to build up our energy around these early years, because for the African child, how you, right from when your mother conceives, how you started, whether the nurturing care environment, the interactions at home, what your parents know, the kind of protection around you, the environment around you, whether you're accessing play and stimulation, do you play with your parents, do your parents know that how you feel matters? All those things build you as an individual. They make you who you later become. So many times you find, by the time we invest in the children, it is almost too late, because we've missed the foundational gap, the critical window of opportunity. And for me specifically, because the Day of the African Child is being launched is being commemorated within this setting, in this refugee settlement. It also speaks a lot to children in crisis, to the children who are most vulnerable. What can we do to support them access early childhood development services? And we know there's a lot of effort that government has put in, and all partners are putting in a lot, but the Sitan is out to give us evidence to say, here is a gap, here is an opportunity, and this is how we can improve. Well, we have the findings along all the 5 components of key early childhood development. When we come to early learning, we know that a number of children are not accessing early learning, and that's pre-primary education. So that's one of the key highlights. And those that are most left out are the ones in rural areas, because pre-primary education is a private sector, it's a private-led entity, but we know that the Ministry of Education has approved the ECD policy, and that gives us a clear way forward and map to make sure more children are able to access, but also there's a clear policy framework that supports partners to deliver. Another key highlight is on nutrition. I think the findings on nutrition continue to be wanting. Many of our children are stunted, and so there's a lot that needs to go in. Us working with under the Nutrition Action Plan to make sure that more children are accessing meals and that they're not left out, even with the food security issues that we have. Child protection is a key area, and in most cases for early childhood development, it's very grey and empty. And as you see in the report, there are many areas. We have children that are, whose parents are incarcerated. They stay within their positions. That's a huge child protection issue because the services around them are not conducive. We have very many orphans and vulnerable children, as you hear from Ministry of Gender, and many of those that are younger without parents. It's very hard to even have interactive relationships that build them. But when we talk about child protection, we know that violence against children in the early years is silent because they don't report. Children in that age don't report. But we need to ensure that they are protected, that they are in safe environments, and that's both at home and at school. When we come to family strengthening and support, clearly you'll see from the report, many of the young children we track them under children that are under poverty, but we know that when families can't access food and they don't have an income, then they cannot provide the basic services for their children. So we know that there are efforts to start to say, how do you include livelihoods within early childhood? But that's one area, and there are many government programs that are really pushing livelihoods and family strengthening, and we need to ensure that these reach the youngest children and their families. We can't underestimate the efforts that have been made in maternal and child health. In the maternal and child health sector, there's a lot of progress, but we also know that even when it comes to antenatal care, the number of times that parents, mothers should be visiting, and that's a very critical component that many women, especially in the rural areas, are not actually going for antenatal services. And that involves many other areas like immunization, but also thriving, that we not only just focus on the alive, keeping children surviving, but are they playing, are they being stimulated, how are they being helped? Because these services are better when they are packaged together. Yes.